Good morning. We now are in the hands of Miss Bettina Campbell.
Good morning. Welcome to this month's edition of the Oak Hill Regional Community Development Corporation's third Wednesday Parent Resource Chat. As he said, my name is Bettina Campbell. I'm a Healthy Kids Mississippi sister, and I'll be your moderator for today. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Lottie Miner. In addition to this Zoomcast, we are restreaming today's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. Feel free to share on your social media pages. Today, we have a dynamic in-house team who will provide general updates about healthy kids and Get Covered Mississippi. I will begin with a focus on minority health. Next, Pastor Montgomery will share about our ongoing pandemic-oriented outreach to churches. Then Clarence Campbell will share about Post-Affordable Care Act 2021 special enrollment options for health coverage. Mary Finner will provide Medicaid and CHIP updates. And finally, our director, Lottie Miner, will provide updates on the COVID-19 Delta variant. Once again, we encourage you to share today's webinar in your social media networks. Feel free to post questions or comments in the Zoom chat or on the social media comments, and we will do our best to answer each question. Okay, so let's get started. We know that this pandemic, COVID-19 pandemic has wreaked havoc on our mental health. Just when we thought it was safe to get back to normal and do the things that we love to do, along comes the Delta variant and throws us back into a sense of deja vu all over again. It's causing more stress and anxiety because we fear exposure for ourselves or our children as they're returning to school. We're not being able to follow the stay-at-home recommendations because many of us are essential workers and we have to go to work. And then the separation from our family and our friends, and especially those that are sick in the hospital, just keeps us stressed out and upset. Grief over the loss of family and friends and family members, not being able to be there for them during that time, the emotional stress of living close together. And then finally, we got to go back to work and our children are at home either because the schools have been closed or because they themselves have been, are ill and we don't have anybody to watch them. We have financial stress of healthcare costs, job related. Are we worried about we can't pay the rent, so are we going to be evicted? can't pay the mortgage, are we gonna lose our house? Where we're gonna live, where we're gonna take our babies? And the ongoing difficulties of just accessing healthcare in and of itself. And then finally, we're all been told to use everything is on the computer, use the computer. And because of where we live, we may not have the bandwidth. And so we have poor access to technology. And so if you're struggling with this and you wonder what's going on and what are some signs of stress, well, if you're having trouble sleeping or you're sleeping too much, you're feeling unsafe or anxious about things, because you upset or you're anxious all the time, you're fighting and you're having a strained relationship with your family members, you're irritable and you want to blame everybody else around you for what's going on because you have no control, you have a lack of energy, and then you have unexplained aches and pains. You're just tired and you don't know why, you're aching and you don't know why. Chances are it's stress. And so I'm going to talk to you a little bit about what are some of the things that we can do to kind of manage that stress, to kind of get it a little bit under control. So one of the main things we can do is follow the physical distancing and other steps to prevent COVID as best you can. Those steps that the CDC says, like wash your hands, wear a mask, for goodness sakes, wear a mask. So because we're trying to protect yourself, your family, and your loved ones, and the community. Take a break from watching or reading or listening to the news. That's what I need to do myself. And make sure that you're getting information from trusted sources. There's so much disinformation out there that's what they're saying on the news all the time. It's disinformation. So you don't know what to believe. So check for trusted sources like the Centers for Disease Control. Stay in touch with your family and your friends by phone, a video call, or other technology. Reach out to your churches and other community organizations because many of them are online, and so that you have opportunities to see family, see friends, see church family virtually. Use prayer and meditation or other spiritual practices to find peace in difficult times. Try to maintain a healthy diet, exercise, and sleep. I'm gonna say that one again. That one needs to sink in with me. Try to maintain healthy diet, exercise, and a good sleep routine. Do not put off urgent and emergency health care for new or chronic illnesses because we're scared. We don't want to go to the doctor. We don't want to go to the emergency room because we're afraid of that we might be exposed to the virus. But it's critical that you take care of your health, even during these times. And that's why I'm so glad that we have some people that will be following me that will be able to talk to you a little bit more about how to take care of your health. And if you cannot work, then apply for unemployment insurance in your state during the pandemic. The rules for you to apply have been loosened because of the pandemic. And another thing about the evictions and the mortgage, check with your state because there may be some help for assistance for renters and with renter and also with your mortgage payment. So check with them and your utilities. Check with them to make sure before you let things get too far behind. And then the last thing I'm going to talk about is connecting to cultural traditions and heritage as they can provide strength in difficult times. And then use the hotline for resources that you need because there is help out there. Don't be afraid to reach out. And if you don't know, ask somebody. There is never no shame in asking somebody so that you can get the help that you need because your mental and your emotional health is just as important as your physical health. So in fact, if you don't take care of either one of them, you let one go, the other ones will suffer. So now, I think I've said enough about that for now. So we're going to hear from Pastor Montgomery, who is going to talk about pandemic-oriented outreaches to the churches.
Good morning, Sister Campbell. Thank you for the opportunity to be able to share with you this morning concerning the church's input and information with this new variant that is upon us. Certainly, we will ask that the church take extra precaution based on the parishioner that would come from various homes and settings. So if you're doing in-person worship, please be advised to continue to adhere to the guidelines of certainly church needs to post, we suggest that you post a mandate for mask wearing and also the safety distance of, I know sometimes they've gone back to 3 feet, but I think we still now should be at the 6 feet in distancing for of safety precaution, and ask family members that do come in person to sit together. And I know it may not be traditional, the seat or the location where they've been sitting at, but ask those family members to sit together. Also, even in our church setting, let's encourage the vaccine. We cannot mandate that anyone take the vaccine, but let's try to encourage them, to let them know, to remind them that we are our brother's keeper. And our responsibility is to our sisters and brothers, and certainly those the people that are with underlying conditions that are vulnerable, even our children. Let's not make this a political issue or a personal issue. Certainly, as we look at in our history, based on what things have happened to us when it comes to medication and the welfare of us, when it comes to prescription and trials and those type things, but we got to trust God in whatever we do. Not only that, when we receive this information about pros and cons of the vaccine, trace your resources. What did it come from? Is it a personal opinionated, or did it come from some professional? And certainly, again, do not make it political, because this is about life and death. Not only that, let's encourage virtual settings. And I believe that God understands what we are attempting to do for the continuation of our ministries and our various locations. So let's encourage some virtual settings. Also, let's combine some virtual settings so that we can value each other's time and opportunities that we can share on different webinars. And I know that at this particular time, many of us are debating what we need to do concerning our worship, when a lot of us had started to move back into what we consider at the particular time our norm for worship on Sunday mornings, but now many of us have paused that to a halt. Let me share, this is my personal opinion. Don't allow anyone to tell you that you're weak, that you lack of faith because you're shutting down or you're taking different measurements concerning COVID. And many people say, well, I hadn't stopped, I trust God. Sure, we trust God. But it's amazing to me, the same individuals that say they trust God and they're not going to shut down the church, as soon as they get out of their car, they clicking the alarm button. Listen, don't click your alarm, but trust God to keep your car there when you come back, and you're making sure that the security guard is at the door. Let the security guard go home and trust God. You're leaving a night light on at home. When you leave, turn the light off and trust God. What I'm saying is, let's not be, I don't want to say hypocritical, but let's not be contradictory when we're talking about how far we're going to trust God. We're talking about life and death. Surely I sit here this morning and I trust God. And I believe that God has allowed us, with medication and with research, that these vaccines are safe. We're going to take them and pray that God continue to keep us. So let's remember that, listen, just because you shut down, that is not a lack of faith. Don't let anyone tell you that you're weak, but make sure that we trust God in what we're doing. Even now in the hospital visitation, it is limited now. Some have actually closed down. So let's not be adamant and unruly. Let's go with the guidelines based on what these healthcare providers are recommending that we do. And if we do that, I believe that God will continue to take care of us. Let's be prayerful. Let's be vigilant. Let's be willing to work together until God bring us out of this predicament that we're in. God bless you and God keep you.
Thank you, Pastor Montgomery. You shared a lot of information. It was good information. I really hope that people were listening and that they not only listen, that they hear it. For me, the next panelist needs no introduction. Let's hear from my husband, Clarence, who will talk to us about the Post-Affordable Care Act of 2021 and special enrollment options for healthcare insurance and coverage. Clarence?
Okay, good morning, everyone. Okay, Sunday evening, a special enrollment program that had been implemented by President Biden as part of the American Rescue Plan ended. During this special enrollment period, which was actually a special enrollment period, because SEPs have been a part of the Affordable Care Act all along. But this extended special enrollment period allowed virtually anybody that wanted to apply for healthcare coverage through the Affordable Care Act, aka Obamacare, and usually see their premiums greatly reduced by using the advanced premium tax credits. As a navigator, I worked with quite a few different individuals, and quite often I would see people get very nice plans for sometimes $30 a month, sometimes $8 a month, a lot of times $0 a month premium with a $0 deductible, meaning that the healthcare coverage that they previously did not have began August 1st, or in some cases, it won't start until September 1st. Okay, now, just because the American Rescue Plan version of the special enrollment program has ended does not mean that people are not eligible for applying for coverage through the Affordable Care Act. And before I go into that, I want to share a little bit of information I dug up. This information says that a study published by the American Journal of Public Health in 2019 found that 66.5% of bankruptcies in the United States were due to medical issues like being unable to pay high bills or lost time due to work. Even with health insurance, high deductibles and co-pays, plus job losses impact Americans. Okay, so a lot of times people might lose a job and get laid off, but they find that they are eligible for COBRA. COBRA is essentially an extension of the healthcare coverage that might have been provided through the job, but it was quite expensive, $1,500, $1,600, $1,800 a month. And so how are you going to pay for this coverage when you don't have a job, you don't have a source of income right now, or the small amount of unemployment you get isn't going to cover your other bills as well as an additional $1,500 a month? Well, through special enrollment period provisions, there's quite a few different ways that you can qualify for a special enrollment plan. There's some of the ways that you can qualify include losing your healthcare coverage. So you can, if you lose your healthcare coverage because you lost your job, you can apply for the SEP. A change in household size, you gained a member, maybe lost a member of family, unfortunately. You moved, you have a change in your primary place of living. There might be a change in eligibility for marketplace coverage. There's various changes in eligibility that could now make you eligible where you previously were not. Or it could have an enrollment or plan error. Just last week, I worked with a consumer that had enrolled in a plan through, I'm not exactly who helped them enroll in it. It wasn't one of the Get Covered Mississippi navigators, but this plan, the consumer had been promised certain deductible limits, out-of-pocket limits, and she was finding out that these weren't true. So by taking advantage of the special enrollment provisions through the Affordable Care Act with an error in this plan that she had been enrolled in, she was able to get re-enrolled in another plan that was backdated to the original enrollment date. Okay, then there's also, as we talked about the change in your household size, you get married or have a baby. So depending on your special enrollment period type, you may have 60 days before or 60 days following the event to enroll in the plan. And then you can enroll in Medicaid or children's health insurance at any time, Medicaid or CHIP. And so the advantage of the special enrollment period and attempting to try to see if you're eligible for marketplace coverage and advanced premium tax credits is marketplace plans are going to cover 10 essential health benefits, such as ambulatory care, emergency services, hospitalization, pregnancy, maternity, newborn care, mental health and substance abuse services, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, and pediatric services, including oral and vision care for children, but not necessarily for adults unless they purchase this additional coverage. And then one of the big pluses of insurance through the marketplace, through the Affordable Care Act, is this covers pre-existing conditions. So a person may have lost coverage through their job and they have some type of serious illness that, or condition, just could be a chronic condition that the previous plan was paying for. There's a lot of plans outside of the marketplace that may not or will not cover these chronic conditions that you may bring into the new plan. With the Affordable Care Act, these plans are covered from, or these conditions are covered from day one that your coverage becomes effective. One of the things I'd like to say about the plans that are available, first of all, I don't represent any insurance provider, but here in Northern Michigan, or Mississippi, our two providers are Ambetter and Molina. And so one of the plans that I saw popping up for that a lot of consumers are eligible for would be the Ambetter Balanced Care 11 plan. I was able to get a lot of people enrolled in this plan. And this particular plan quite often would have the $0 deductible, so coverage would start right away. Maximum out-of-pocket expenses for these folks was around $1,200 for the remainder of the year. That's the maximum they would have to pay. And then very low co-pays for primary care doctors. A lot of times, no co-pay for primary doctors, no co-pay for tier 1 prescriptions. Specialist doctors, if they need them, were usually around $10, maybe $15, $5 copay. So these are all plans that an awful lot of people can qualify for that can help them first maintain their health and then possibly avoid a bankruptcy situation because they incur huge medical bills and they have no insurance to cover them. These plans are also quite less expensive than the COBRA plans. Even the most expensive plans I found were usually several $100s cheaper than what an individual may have been able to obtain through COBRA. So one thing that we're not supposed to give advice to people. So one thing that I would share with individuals is, yes, you may have lost your job and you may not be able to afford these premiums, or you don't think you can afford these premiums, but just ask them to consider which is more difficult, trying to raise $200-300 a month sometimes for insurance, or coming up with several $1,000s to pay for the bill that you would have to pay if you didn't have insurance. So what I would encourage anyone to do is, if they find themselves in a situation, even now after the special enrollment period is ended, the one through the American Rescue Plan, to contact one of the navigators, get Covered Mississippi, and see if there's some way that you might still be eligible for a marketplace plan and/or advanced premium tax credits. You don't have anything to lose. You might find that you have a lot of very low cost options that are available to you. And as we are enrolling people in coverage through the Affordable Care Act, filling out the application, one of the things that healthcare.gov website does is if this person has children that are under 19 years of age living with them, the system checks to see if they qualify for Medicaid or CHIP based off of the household income levels that have been submitted. And these children are automatically submitted for Medicaid or CHIP, depending on the age of the children and also the household income. Right. Unfortunately, there's going to be times when one reason or another, people don't qualify to purchase coverage through the Affordable Care Act, or maybe they don't qualify for the advanced premium tax credits and they just can't afford it. Sometimes they just don't have any real source of income at this time. So we still have another great option that's available to people. These are the federally qualified health centers. Okay, eligibility for the federal qualified health centers. These are community-based healthcare providers that receive funds from health. Oh gosh, we'll just say HRSA, since I can't remember what the acronym stands for right now, to provide primary care services in underserved areas, and they have to meet a stringent set of requirements. Among these requirements, they provide care on a sliding fee scale based off the person's ability to pay. The services that the health centers provide include preventive health services, dental services, mental health and substance abuse services, transportation services necessary for adequate patient care, and hospital and specialty care. And according to one site that you can go to as you're seeking to find a health center, federally qualified health center, there's 295 in Mississippi. Now, of this 295, sometimes it might mean that there's 3 or 4 different providers at the same physical location, but there's a lot of places, a lot of providers that you can go to in the federally qualified health centers that can get your health needs taken care of if you have no other options. There's one website, findahealthcenter.hrsa.gov, that allows you to type in the name of a city, and then it'll show you the centers within a given radius of that center, such as centers that are located within a 5-mile radius, 10-mile radius, 20, 30, 40-mile radius. So depending on where you are and how far you can drive and get transportation to, you can find centers. And then there's another website where you type in the name of the city, and if that city has a center in it, then they'll show you the centers in that city. So if you typed in Jackson, Mississippi, about 20 different centers would pop up. If you typed in Holly Springs, Mississippi, since there's none that have an address with Holly Springs, none would pop up. But we can certainly get you these websites so that you can search for the federally qualified health centers, or you can call us and we can search for these for you. So that's about all that I have to cover at this time. If you have any questions, please submit them and we'll do our best to answer them for you.
Thank you, Clarence. You did a good job, even if I am a little bit biased. But speaking of Medicare Medicaid and Children's Health Insurance Program. Let's hear from Mary Fenner with updates. Mary?
Good morning, everyone. I'm a Medicaid assister with Healthy Kids Mississippi. And what we do is help and assist parents and children with any issues or concerns they may have with Medicaid. As we all know, some of the offices are open now, but if you have a concern with going into the office because of COVID or the new Delta variant, you can call us and we can assist you with any problems or help with applying or renewing your Medicaid applications. Okay. It's important also that you update your mailing information with the Medicaid office, because I had a consumer last week that was cut off because she failed to, or she forgot to send her new address to Medicaid office. So if you have moved within the year since you have heard from them, it's important that you contact them and submit your new address to them, because they will cut you off if they don't hear from you. Okay. Also, when you apply for Medicaid, and if your children are not eligible for regular Medicaid, they will put an application in for the CHIP program. But if you get denied because you were over income for CHIP, what you can do is reapply if your income changes. If 1 month you had less amount or you have more amount, because some of us don't get the same pay every month. So if the next month you get a lower pay, then you can always reapply. There's no restriction on reapplying for Medicaid. You can reapply at any time. And another thing that we have a collaboration with the Head Start programs. So if any of your children are enrolled into the Head Start program and you need assistance with Medicaid, we have assistants that are working with the Head Start program, and you can contact them and they should be able to help you with any issues or refer you to whoever can help with your issues or concerns you may have with Medicaid. And that's it for today.
Wow, thank you, Mary. You really shared a lot of information. I hope people again was listening, and that if they have any questions, they won't hesitate to call, because health insurance is important. So thank you for that wonderful information. And now we get to hear from our Healthy Kids Mississippi Project Director, the dynamic Lottie Minor. And she will give us updates on the COVID-19 variant. Lottie, I have a few questions for you. How many Mississippians have been vaccinated?
Well, and good morning, everybody. Mrs. Bettina, I don't know how dynamic I am, but I'll do the very best I can this morning. So how many have been vaccinated? You asked me. So as of yesterday, and we try to keep our research fresh. So as of yesterday, 36.5% of Mississippians 12 and older have been fully vaccinated. 43.8% have received at least one shot. So that means they're halfway there.
What does it mean to be fully vaccinated?
Okay, that's a good question. According to the CDC, the Centers for Disease Control, people are considered fully vaccinated 2 weeks after their second dose of the Pfizer or the Moderna vaccine, because those are the ones that require 2 doses, or 2 weeks after the single dose of the Johnson & Johnson Janssen vaccine. Anybody who hasn't met those 2-week thresholds, regardless of their age, is not considered fully vaccinated.
Okay, well, I'm fully vaccinated, so what can I do?
Okay, and I know there's been a lot of information out there about a lot of misinformation, as you mentioned earlier, but everything that we're quoting here is coming from the CDC, the Centers for Disease Control. So their recommendation is that fully vaccinated people wear a mask. And here's what we got to pay attention to. They wear the mask in public settings, in areas of substantial or high transmission. So in the state of Mississippi, we know that all over the state, the transmission is high. So that means whether we're vaccinated or not, we need to wear the mask. Now, fully vaccinated people might choose to also wear a mask regardless of the level of transmission, if they are in a situation where they are immunocompromised, where they have, a decreased immune system, or if they are at increased risk for severe disease. So that would be people who have certain comorbidities or medical conditions, things like diabetes, things like heart disease, cancer patients, particularly those who may be taking chemotherapy, individuals who are taking dialysis, and of course, the very elderly would be considered in those risk groups. So the other reason that a vaccinated person would also want to wear a mask would be if someone in their household is immunocompromised. So it may not be you that has one of these comorbidities or who is very elderly. It may be someone in your household, your spouse, your parent, your sibling, whomever. Or the final group that you want to make sure you're wearing a mask when you're around those people, even if you're fully vaccinated. The final group would be anyone in your environment who is not fully vaccinated. So let's peel the onion back. Let's say that Sister Bettina and I are both fully vaccinated. But let's say we are living in a household with someone who has cancer, HIV, diabetes, heart disease. In those situations, we want to be extra careful, or maybe we work with someone like that, or we sit beside somebody like that in some other setting. Even though we're fully vaccinated, we want to wear a mask. Or let's say we're around someone who is not fully vaccinated. I'll use myself as an example. I am fully vaccinated, have been so for months, but I have someone in my family who does not live with me, who is not fully vaccinated and is very elderly. So in a case like that, I mask up. So finally, the CDC recommends that fully vaccinated people who have a known exposure to with suspected or confirmed COVID-19 be tested 3 to 5 days after exposure and wear a mask in public indoor settings for 14 days or until they receive a negative test. Let's break that down. So if a fully vaccinated person goes around someone who they suspect has COVID or who they know has been diagnosed with COVID, that person, that vaccinated person, needs to be tested 3 to 5 days after exposure because there's like an incubation period. Continue to wear their mask for 14 days, even when they're inside, and make sure they get a negative test result to help reduce the spread of the virus.
Okay, so do I need to show proof of a negative COVID test or a vaccination prior to travel?
So if you choose to travel in the United States, you do not need to get tested before or after travel. You do not need to self-quarantine after travel. If traveling internationally out of the country, pay close attention to the situation at your international destination before traveling outside of the United States. You do not need to get tested before leaving the United States unless your destination requires it. So you'd have to do your research. You do need to show a negative test or documentation of recovery from COVID-19 before boarding an international flight into the United States. The CDC recommends you still get tested 3 to 5 days after international travel, but you do not need to self-quarantine after arriving in the United States.
Okay.
So international travel is the trickiest situation when talking about traveling.
Well, it sounds like that if I decide I want to go outside of the country, I better take some extra money or have a good credit card just in case I can't come back when I want to come back.
Absolutely.
All right.
Or just don't do it right now.
That's better still.
Mhm.
What if you're not vaccinated? What activities should you or should you not participate in?
Okay, so let's approach these different activities that you should or should not participate in from the outside in. All right, so let's first look at outdoor activities. The safest outdoor activity that an unvaccinated person can do is walking, running. If they're wheelchair bound, they can do the wheelchair roll. People can bike outdoors with members of their household. Unvaccinated people can attend a small outdoor gathering with fully vaccinated family and friends. While masked, they can attend small outdoor gatherings with fully vaccinated and unvaccinated people, particularly in areas of substantial high transmission. So outdoor is relatively safe. Probably it is the safest environment for the vaccinated and unvaccinated. Okay, so that's the safest. The next level, the less safe outdoor activity. So while masked, an unvaccinated person can dine at an outdoor restaurant with friends from multiple households. Now, you know, if you're dining out, that means you're eating, you got to take your mask off at some point. So with that, it would behoove you to, you know, eat your meal, and then while you're socializing, make sure your mask is on. You know, if you're really conversating within your meal, make sure you're putting it back on between bites when you're just conversating. Now, the least safe outdoor activity. While masked, an unvaccinated person can attend a crowded outdoor event, like a live performance, a parade, or a sports event. That is the least safe. So I'm not a medical professional, but I took a class called CS 101. Some of you know what CS 101 is. Common Sense 101. Okay, so that would mean if you are unvaccinated, yeah, you can go to these events, but our recommendation would be that you not do so, because that is the least safe outdoor activity. All right, indoor. Let's go from less safe to least safe. While masked, an unvaccinated person can visit a barbershop, a hair salon, go to an uncrowded indoor shopping center or museum, attend a small indoor gathering of fully vaccinated and unvaccinated people from multiple households. So an example of that would be somewhere like church. If you're unvaccinated, you may certainly go to church with a mixture of vaccinated and unvaccinated people, but the idea is to keep the mask on. The least safe environment indoor would be a place like an indoor movie theater or a full capacity worship, like if it's a really big church, like a mega church and everybody's sitting together closely. Also, singing in an indoor choir would be one of the least safe environments. Eating in an indoor restaurant or bar would be one of the least safe environments. Participating in indoor high intensity exercise classes. So, for example, if you are unvaccinated, you probably would not want to go to the big fitness centers and take your Zumba class or take your yoga class, because you got a lot of people who are probably unmasked in a very close-knit setting. Okay. Did I answer your question, Sister Bettina?
Yes, you did. You did a very good job, a very thorough job. What do you know about the COVID-19 vaccine? What don't we know, I should say? What don't we know?
Okay.
Tell us a lot.
What don't we know? Well, the CDC says that they are still unsure of how effective the vaccines are against variants of the virus that cause the COVID-19. Early data indicates that vaccines may work against some variants, but are less effective against others. They are still learning how well the vaccine protects people with weakened immune systems, including people who take immunosuppressive medications. So that may be chemotherapy medicine or AIDS and HIV medicine, or medicine for people sometimes with diabetes or MS. Okay, the CDC is also unsure how long the COVID-19 vaccine can protect people. There's a lot of talk about that in the news right now, talking about a booster. That's not definitive. What they're saying about the boosters right now is iffy, okay? We know more about the vaccine than we don't know. Let me say it that way. There's more positives that are known than negatives that are unknown about the vaccine. So what we do in our congregation, in our CDC, in our community where we function, is we encourage individuals to err on the side of caution and take the vaccine. As Sister Bettina has said, don't be sidetracked by the misinformation. Zombies. I took the vaccine in February. I'm not a zombie. Sterilization. There's no proof of that whatsoever. The other one I think that I heard was increased muscle mass in women. I wish I did have some increased muscle mass. That is not one of the
Unfortunately, it's not.
that is not one of the, and I'm
I
glad
wish
Pastor
it- I
Montgomery
wish
gave
it was.
I'm so happy that we can't see everybody's screen, particularly Brother Duke and Pastor Montgomery. But you all get the idea. Let's listen to the facts. Let's trust the facts. Let's have faith over fear in terms of what this vaccine can do and cannot do. I'll go a step further. We hear a lot of talk about people not knowing what's in the vaccine. We don't know what's in our Tylenol, but we open a bottle all the time and swallow 2 or 3 or 4 and go about our business. Okay. That's just me.
But you kind of mentioned the vaccine booster. What other information can you share about that?
At this point, I don't want to share anything else about it because we don't have a whole lot of information other than the fact that last week, the U.S. health officials recommended boosters for some people. Some is the key word, with weakened immune systems, such as cancer patients and organ transplant recipients. This week, the U.S. health authorities are expected to recommend an extra dose of the vaccine for all Americans 8 months after they get their second dose. Okay, this is what the expectation is. All right, the move is being driven in large part by both the highly contagious variant. And think about this now, those of us who've been vaccinated for months, this variant had not appeared yet when we got our vaccine. And preliminary evidence that the vaccine's protective effect starts dropping within months. And that's almost any vaccine. It's going to be that way. So if the shots are expanded as expected to other Americans, among the first to receive them could be healthcare workers, nursing home residents, and other older people. So it won't be everybody right off.
Okay, so that's good information to know. We're covering a lot, so you've shared so much valuable information. Is there anything else that you would like to share?
Yes, ma'am. To you and those that are watching, just remember that you can get your latest state updates for our Mississippi residents at the Mississippi State Department of Health website. Okay. For national updates, individuals may go to the Centers for Disease Control and Prevention website, not Facebook, unless it is a direct link to one of these sites. All right. Or it is an entity like ours who is drawing their information from a trusted source. Because if we post it on our Facebook page, we've obtained it from one of these entities. for additional updates, other than Facebook, like I said, just go into these websites and look for yourself. And of course, the most important thing is just follow the basic safety rules: physical distancing, mask wearing, hand washing.
Thank you so much. It's so important that we do that, and that we realize that just because we've been vaccinated, we're not necessarily totally safe.
Right. Nothing is
That we are
100%.
safer. There and that we're safer. And so we want everybody to stay as safe as they possibly can. So I'm hoping that you heard the information from Sister Lottie and that you will let it apply to you. Now we're going to be open for the Q&A period, a question and answer period. If there are any questions in the queue, in the chat box or online, can we check to see? And if there are, we'll answer those questions. And if not, if you have questions, you can still put them in the chat, or you can put them on your Facebook screen, or you can open up your mic and ask the question if you're on Zoom.
You mean type it or ask it? Mrs. Bettina,
Yes.
I have a question that I've heard. What do you do? And this is going back to the mental health issue. What do you do if you find that you have a loved one who you believe is suicidal? We know you've already told us that we see more of that in the pandemic.
Well, if you have someone in your house that you think that might be suicidal, I mean, people, they're acting radically different or a lot different from what they would normally act, and it seems like like they need help, you can always go to the emergency room, take them to the emergency room, or call the EMS, ask for assistance in transporting that person to the emergency room, and where they will do an evaluation of that person and make a determination for you. There's also there are hotlines that you can, national hotlines that you can call, and state hotlines that you can call also for help. And there's information also on different that's going to be posted on our website about those hotlines, and about you can even do a web chat with one of the hotlines. But if it's you think it's of urgent nature, and take them straight to the emergency room.
Wonderful, thank you.
And I think that it's
go ahead.
I think that it's important to say that with children, it may not look like the typical what we would expect it to look like. And so if your child is if they're acting out, or if they're withdrawn, or if they're just doing things that seem way out of the norm for them, then you may want to have them checked out also.
So the signs of possible suicide or suicidal tendencies look different in children from how they do in adults sometimes.
Sometimes they will look different, yes.
I have another question from Mary Fenner. You talked about families who may get denied for Medicaid, and then the state will automatically move them over as a CHIP applicant. And if I'm understanding you correctly, Medicaid is for the neediest families, and CHIP is for those who are less needy.
That's true.
So go ahead.
If your income is higher and you didn't meet the qualifications of the income level for regular Medicaid, they automatically put in the application for CHIP program.
So what if somebody gets denied and a month later their income significantly, unexpectedly decreases? Can they reapply?
You can reapply for Medicaid at any time. You can do an application one day, get denied, and do an application that same day. There's no restriction on how many times you can put in an application, no waiting period. If something has changed within your income, and you can just put an application in right then and there.
Perfect. Thank you. I have a question going back to the COVID issue, and we didn't talk about this. Sister Bettina and I didn't talk about it, but this is something for Dr. Minor and Brother Duke to research in the background. We need to share, I'd like to share going forward a little bit more information about the incidence of people who are vaccinated getting sick with COVID. I want to talk about that a little bit. Some of the people who don't want the vaccine or who have doubts or hesitancy about the vaccine state that you can still get the virus. All right, yes, if there is a possibility that a vaccinated person can still contract COVID-19. But the difference between a vaccinated person and an unvaccinated person getting the vaccine is that individuals who have taken the vaccine are, I would say, probably 98% less likely to get major illness from it, to be hospitalized, and to die from it. So those few stories that I've heard people quote from mentioned from Facebook and other places, you've got to remember that those are social media stories, okay? And somebody's telling a story, okay? They're not being transparent, they're not being truthful, because again, the incidence of death for a vaccinated person is very low to almost zero. Okay, is it 100%? Absolutely not. But neither is any other medical intervention that we have. Okay, I hope that helps. All right, so I see that Maria Morris from the Community Health Center Association of Mississippi has joined our call. Welcome, Maria.
Can you hear me?
Yes, ma'am, I can. I see that you have your hand up. Was there something that you would like to share with us?
Yes, I do my own informal survey around COVID. You know, anybody who comes around my house, I ask them about their vaccine status and that kind of thing. But one of the things that I've been getting of late that I would like for you, if you have opportunity or information to provide insight on, is a couple of adult individuals has indicated that one of their hesitancies around the vaccine being authorized on an emergency order with FDA, and they feel because it was implemented under an emergency order, it is not approved by FDA. Can you share your comments as it relates to that situation?
That is a great question. And we hear that question or that comment a whole lot. And what I'm doing as we're speaking here is I am pulling up the FDA website. So thank you for that question, Maria. All right. So I'm going to read straight from this because this is the official site. And I'm going to share a little bit. I won't be able to share a whole lot, but I'll share some. What it means when there is an emergency use authorization. And this is not the first time that the FDA has done that. And Dr. Minor is going to come on camera in a moment because he's standing here speaking, but I want him to come around and say, if I don't say what he's trying to tell me. But basically what that means is that is the FDA's effort to strengthen the nation's public health protection against whatever threat there is. It may not be an infectious disease like COVID, but they do the same thing if there is a public health threat for chemical, biological, radiological, or nuclear threats. And those things happen sometime and we probably don't even realize it's happening because the FDA is on their game. So what they do is they facilitate the availability and use of medical countermeasures needed during these health emergencies like this pandemic. All right, and this is an emergency situation that has been going on since last year. So the FDA in these cases can authorize unapproved medical products or unapproved uses of approved medical products to be used in an emergency to diagnose, treat, or prevent serious or life-threatening disease conditions caused by these chemical, biological, radiology, or nuclear threats. The Office of Health and Human Services, the U.S. Department of Health and Human Services, has a declaration to support these types of measures based on these threats. So this is not anything unusual that has happened, and it does not mean that the scientists have not tested these drugs, okay? They go through testing and they're vetted tremendously. And we got to remember that if you look on a can of Lysol, you go to the oldest can of Lysol you have, you know, if you got one sitting around, you probably don't, but I like to read things, read the bottle, read the ingredients, read cans. Coronavirus was listed on your Lysol can way before we knew what COVID-19 was, because the coronavirus is part of the SARS virus. And we've all heard of SARS way before last year. So there were already measures in place for interventions for these types of viruses. But COVID-19 is what's considered a novel virus. That particular strain was new. So they had to come up with something as an emergency intervention, but it has been vetted and tested by scientists. There were clinical trials that started almost as soon as the virus appeared. So I hope that answered your question, and thank you for asking that, Maria. Thank you. That's a great question.
You are very insightful in providing that knowledge about it and the background of it. I think it's very important for people to know that under no circumstances would our government entities expose us to stuff that propose more risk than by instituting something under the emergency order. But I just needed you to say that live on Facebook.
Yes,
so
ma'am. Yes,
thank you
ma'am.
so
Thank
much
you.
for sharing that
Thank
information.
you.
That was
Thank
very
you for
good.
that question. Yes, ma'am.
Yeah.
You know, it's funny you asked that. I saw a post on Facebook the other day from someone that I knew many, many years ago who she was trying to be political in her post. And we got to remember that attacking a threat like this is not political. It is public health and safety. And what she was trying to say was that the government had poisoned people previously. And what she went back to was something about prohibition. And it was crazy. It was all made up, saying that there was poison put in the alcohol during prohibition. Now, what the truth of the matter was, is that the people that were making bootleg alcohol, they were making all these things illegally during prohibition, were putting things in it themselves, using whatever they could use to make it. It was not the government who was providing this, but they grabbed everything but the kitchen sink and threw it into these products and sold it on the quote unquote black market because alcohol was illegal. So totally different situation.
Yes, thank you so much for that answer.
Yes, ma'am. Thank you for the
Thank
great
you.
question. All right. Sister Bettina, it is back in your hands.
Dr. Minor, did you want to say something?
No, I think Sister Minor got everything lined up. The only other thing that I would add is that the CDC now, the FDA, let me make sure I'm on.
We can hear you.
Okay.
Well,
Yes, the FDA within weeks will have the final approval on this vaccine. So regardless, if you've been concerned because it's under emergency authorization, within the next few weeks, it will be fully approved, and there'll be one less excuse that people have. That's all I wanted to add. So Sister Bettina's back in your hands now to wrap it up, and another great session today. Thank you.
Yes, thank you so much, all of my team. It was really insightful information that you shared with us. And we are here to try to be able to provide some of the answers for our community. And so if you have questions about health insurance, again, remember that you can always contact us at Oak Hill. There is a website that you can also learn more about our information. It's a oakhillregionalcdc.com and www.healthykidsmississippi.org. Again, that's www.healthykidsmississippi.org. So we want to thank you and to remind you that on our next third Wednesday Parent Resource Chat, which is to be September the 15th, we will have our guest panelist, Dr. Susan Wilford from the University of Michigan School of Medicine, and she will be talking about providing us with updates on children and the COVID-19 vaccine. So please join us. And so once again, we'd like to acknowledge our board chair, Jennifer Garrett, our executive director, Dr. Michael O. Minor, and our project director, Lottie Minor. This has been a production of the Oak Hill Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. Again, thank you for joining us, and you have a blessed day.